Hey everybody, we are going to start talking about vital signs today. We're going to learn about them and then we're going to practice them. So let's get started. Oops, sorry, too fast. Okay, so vital signs include, most of you already know this because when you've gone to the doctor, they've taken all of these things for you. They take your temperature, they take your pulse, they count your respirations, they take your blood pressure. But part of the vital signs that they also take or that are required is also a height and weight because they check your BMI. And that's something that Medicare and Medicaid and insurance companies generally require, is that a height and weight are checked on a patient just so they can check your overall health with that as well. Vital signs must be measured and reported and recorded accurately. And what that means is not only do you have to chart them, but you also have to be sure that you report anything that's abnormal. So we're going to learn about abnormal vital signs. And the reason why it's important to report abnormal vital signs to a provider is because it can help them determine what's going on with them, what's wrong with them, and how to treat them. So you have to be sure that you get a good blood pressure, a good pulse rate, you count it accurately. Same thing with respirations and a blood pressure. If you're not sure of any measurement ever, or you're having a hard time counting it so fast because pulse is so fast, or you can't hear the blood pressure, then you recheck it again. And if you still can't do it, then you have somebody else come in and help you with that. So when do we take them? When a person is admitted for any kind of health care. So that would be in the doctor's office. If you're in the hospital, you go to the emergency room, minor emergency, anytime. Patients that are hospitalized, we usually take them every 4 hours. If someone's in outpatient therapy and they're getting blood, we check them every 5 minutes for 15 minutes, and then twice, like 15 minutes, and then 15 minutes again. And then we check it every 30 minutes for the remainder of the time that they're receiving blood. So for the next 3 or 4 hours, we're going to check it that often. And then we're going to check it afterwards. We want to check it if somebody complains of pain, or if they're taking a medication and they're not sure how it's going to affect them. We also sometimes have to take blood pressure, not just sitting up. We have to check it laying down, sitting up, and standing. Those are called tilt blood pressures or tilt vital signs. And we do that because sometimes people will have a low fluid volume and they'll get dizzy and lightheaded when they go from laying to sitting or sitting to standing. If anybody has shortness of breath, they have chest pain, weakness, anything going on, pain, we want to check those because vital signs can tell us a whole lot about it. Sometimes a patient will tell you pain-wise, they may tell you, oh, my pain's a 3, but when you check their blood pressure, it's really high and their pulse is really high. So they may not be telling you actually how bad it hurts, or maybe they hurt really bad all the time and now it's just super bad. So there are lots of reasons that we take blood pressure. Anytime anybody's on any kind of blood pressure medicine, or they're on a respiratory drug, or they've been sick, we want to check those kind of to see how they're progressing as well. Factors that affect vital signs. So if somebody's sick, it's going to change their vital signs. It can make their blood pressure, it can make them all elevated, or it can make them lower, or it can make some higher or lower. Anger, fear, anxiety, and pain. Anxiety and pain and all of those can raise heart rate and blood pressure. They also can raise one of them. So your temperature may be absolutely fine if you're upset, but your pulse and your blood pressure may be up. Respiratory rate may be up. When we exercise or we have physical activity we're not used to, that can alter our vital signs. As we age, you have to remember when someone's really young, their vital signs are lower, but their respiratory rate and their pulse rate may be higher. When we are really old, our body starts to kind of wear out, so vital signs might increase. But a kiddo's blood pressure is going to be lower. Gender, whether you're male or female, sometimes that can change pulse rate and respiratory rate, all that kind of stuff, your vital signs. The weather. So if it's cold outside, you might breathe a little faster. If it's really hot outside, you might breathe a little faster. If it's really hot, your pulse may be up. If you're dehydrated, or if you're overhydrated, or eating or drinking certain things can affect it. Caffeine affects your blood pressure. If people smoke or drink alcohol, it can affect their blood pressure. If people do drugs, it will definitely affect their vital signs. There are certain medications that we take that can slow the heart rate, increase the heart rate, increase blood pressure, lower blood pressure. They may alter respiratory rate. Sometimes they even alter body temperature. Also, the time of the day. In the morning, our vital signs are usually lower than they are in the evening because we've just rested, hopefully, throughout the night. And hopefully our blood pressures and our vital signs are a little bit lower when we first wake up, and then after we're up and we move around, it can increase those. A change in one vital sign will cause a change inevitably in the others. So if blood pressure goes up, lots of times pulse goes up. If respiratory rate goes up, usually the pulse will go up. So those are kind of things that they have a synergistic effect. One altered vital sign will impact the others. If you have fever, it will increase your pulse rate, and it may increase respiratory rate as well as your blood pressure. So all those things, they go hand in hand, the way the brainstem controls those. So what do we report? What do we report if to the nurse or to a doctor or to whoever? What will we report to someone if anything has changed from a previous measurement? So say I'm in the hospital and I'm a patient and I'm in there with pneumonia, and my blood pressure is, when they come in, is 110/70. My temperature is 99.9. My pulse rate is 70, and my respiratory rate is 20. Well, then they go back in, and 2 hours later, and my temperature is 102. My pulse rate is 115. My blood pressure is 160/90, and my respiratory rate is 28. Those are all changes from 2 hours ago. So that would be reported, so the doctor could make adjustments to that if needed, or they could give me a medication that would help with that. Anything that is really high or really low, and we're going to talk about normal ranges, but any blood pressure or any vital signs that are outside the normal range, we would report. That way, we can be sure that anything that's abnormal, someone who can do something about that knows. As a medical assistant, even as a nurse, or as a nurse aide, anything like that, or a tech, we can't necessarily make changes, so we need to report that on to the doctor. Reporting and recording. So most agencies have, like when you go into the hospital, there will be a board that will monitor vital signs. Sometimes it's out front at the nurse's station, but usually patients in their room. Lots of times now they have a board that you can report that on. Most people also put that it should be put in an electronic record. You need to record vital signs when you're done. So when you're done taking a set of vital signs, you need to write that down because you will forget it if you don't. Most people, most nurse aides, most medical assistants, most nurses, we will carry a little flip notebook, spiral notebook in our pocket. That way, when I go into room 104, I can make notes. 2 o'clock, this is my vital signs. 4 o'clock, this is my vital signs. I can do that and then go back and chart that as soon as I'm done with my hall's vital signs. So also know that it's really easy to abbreviate, and these abbreviations for temperature, pulse, and respiration are widely accepted. So temperature is abbreviated as a T, pulse is abbreviated as P, blood respirations are a R, and blood pressure is BP. Those are commonly accepted abbreviations, but you need to make sure they're approved for the agency you work for. So every agency has a list. Anywhere you work has a list of approved abbreviations. If you use an abbreviation that is not approved, you can actually be written up for that because someone might misinterpret it. So you want to be sure that you use abbreviations that are approved and recognized throughout the facility. Respond to a patient or visitor's questions about vital signs according to the policy. So if you don't know, ask somebody. If you don't know the policy, ask somebody. A patient, if they ask you for the vital signs, you should be telling them anyway when you take it. Your blood pressure was this, your pulse was this, your respiratory rate was this, your temperature was this. You should be telling your patient anyway. But before you report that to a visitor, if someone asks you, you need to let them know. You need to make sure that it follows a policy. So there's HIPAA policy out there. HIPAA violations are a big deal, and that's when you give information you're not supposed to another person. So you want to make sure that that person's on the HIPAA policy, the patient agrees to it, and you've documented the patient agreed to it. Otherwise, we do not share information with anyone other than the patient, unless there has been a strict note in there from the doctor ordering you not to give the patient that information. Body temperature. So we're going to start with body temperature, and that is, body temperature is what temperature the body needs to keep all of the systems circulating appropriately. It's a balance between the amount of heat that we produce internally and the heat that is lost. So heat is produced or controlled by muscle exercise, by your blood circulation, by food, and then by the external environment. So know that when your body has to break down food, it needs a little bit. Your temperature will go up a little bit because it's got to be able to work. When you go out and exercise and work out, you guys know that your body temperature goes up a little bit because you're working muscles and you're generating more heat. Also, if you're outside in the heat or the cold, it will change your body temperature. Another thing that changes body temperature is also one of the things that controls your body temperature is blood circulation. So blood circulation itself, the blood itself self-maintain. And a core temperature, your core temperature should be around between 99 and 100. Core temperature is your actual internal temperature, not temp under the arm and not necessarily temp under the tongue. We lose heat regularly by through excretion and respiration. So excretion would be perspiration, urinating, through feces, having a bowel movement, and then when we breathe, it also helps. It changes our temperature, or it affects our body temperature. Because think about it. The room, when it's 70 degrees outside, your body actually has to warm that air before it gets into your body that may be 98 or 100 degrees. If it's 30 outside, those of you who have had to work out lately outside in the cold rain, you know it kind of burns your lungs because your lungs are having to heat that air up. Temperature measurement sites. So we can measure the body temperature in 4 areas. We can do it orally, which is in the mouth, rectally in the rectum, axillary, which is under the arm, or tympanic in the ear. Most of you probably have tympanic. When you go to the doctor, they do a tympanic temperature. They check it in your ear. Rectally, we only usually do that if an infant's temperature is above 102 through the ear, or we can't check it in the ear. Oral temperatures, we check a whole lot at home, and inside the hospital, we do them orally a lot. There's also a temporal probe that they will run across the forehead. It's actually really accurate too, as far as it's as accurate as an axillary or an oral temperature, pretty much. Most temperatures, like I said, are generally taken orally or tympanically now, unless it needs to be taken another way. An axillary or an under the arm temperature is the least accurate. Rectal temperatures are the most accurate. So I would remember the least and the most accurate, and where all the locations you can take a temperature. So these are normal temperature ranges I want you to know the ranges, the normal temperature ranges for oral, rectal, axillary, tympanic, and temporal. 98.6 for the ear, and the forehead, the temporal one. Those are what we consider a normal range. Axillary 96 to 98.6, rectal 98.6 to 100.6, and oral 97.6 to 99.6. So those are the normal ranges. Know the normal ranges, because I may tell you that a patient has an oral temperature of 99.4. Is that normal or is that abnormal? That may be something I ask you. I may ask you questions that way. Glass thermometers, we do not use a lot of glass thermometers anymore, but you need to know the different types. So an oral thermometer has a really long tip on the end. There are some mercury-free thermometers, glass thermometers, but we really don't use them hardly anymore. I've had a few doctors that order those to be utilized, but we really don't, because we're not supposed to have mercury in the hospital setting anymore. There are some mercury free, but once again, we just don't use these very often. The bulb or a rounded end, a rounded tip, that is a rectal thermometer, used only for rectal temps. And then they have a pear-shaped one that can be used either rectally or orally. a thermometer has a bulb, then it has a stem. So the bulb is the actual silver-coated end that goes under the tongue or into the rectum or under the arm, and then the stem is actually where the temperature is measured. Reading a glass thermometer, generally there is some markings on there that tell you where 98.6 is, so you know where normal is. Most of the time inside the thermometer, you will either see a silvery substance or a red substance. The red substance tends to be in the mercury-free, and you will read it based on where the last location, so it'll kind of, just like a glass thermometer or a heat thermometer outside, you'll measure it based on the location. And so it's marked in whole degrees. And usually they're like every other degree. So it'll be 94, 95 might not have a number, 96 would have a number. And each marking after that is 2/10. So it would be 98.2, 98.4, 98.6, 98.8, and then it would be 99. So generally it's marked in whole number increments, usually even whole number increments are the numbers you'll see, and then each small hash mark past the long hash mark would count as 2/10. Most thermometers, glass thermometers, or whether they're mercury or mercury-free, the lowest temperature they will read is 94, and the highest temperature they'll read is around 108. So know the range, the scale for the marked temperature, and just know like how it's marked. Electronic thermometers, these we see a whole lot. These are kind of some older ones, though. The one on the left's not that old, but the one on the right's pretty old. They're battery operated. They are rechargeable. They have a probe cover, and then they will have a probe. The blue one is generally oral, and then they'll have a red probe color in that's generally a rectal thermometer. You cannot use the oral probe in the rectum, and you can't use the rectal probe for an oral temperature. You have to choose the correct probe. Usually they register within 15 to 30 seconds. An ear probe reads a lot faster. The disposable covers, then once you're done, you eject them off in the trash, wipe it down, and move forward. Digital thermometers, these are probably the ones you guys are pretty familiar with, because most everybody has a digital thermometer at home. You put a probe cover over the end of that. It stays in the under the tongue for usually 1 to 2 minutes, and then it will beep when it's done with a temperature reading. There are disposable oral thermometers, and basically what happens to them is they turn blue. Like that one has an orange coloring, and it will turn blue to help you read the temperature. Some of them are blue and they turn red, but it will basically change color to tell you what temperature it is. Tympanic thermometers, these are the ones you guys probably see at the doctor's office. They have a disposable cover over them. And it usually takes a couple seconds for it to read. You want to always kind of lift the ear up and away from the head before putting the tympanic thermometer in for an adult or a child. And then on an infant, we're going to pull back on the middle of the ear just because of how their ears are. Like I said, reads in about one or 2 seconds. When we take a temperature, if you're taking a temperature with a glass thermometer, you have to actually shake that thermometer down to where it is you see it below the 94 mark. This one says to leave the thermometer in place 2 to 3 minutes. Most doctors will want you to leave them in place for 5 minutes. Patients don't like to keep a thermometer in their mouth 5 minutes. And you always use a probe cover to cover that up. And then also another thing about oral thermometers, if someone has eaten or drank anything, whether it's any kind of oral thermometer, you have to wait about 20 minutes before you take a temperature. At least 15, but preferably 20 minutes before you take a temperature, so that the mouth has had time to recuperate from eating or drinking anything. Guidelines for taking an oral temperature. Don't take the temperature. Don't take an oral temperature on an infant or a child under the age of 6. They don't know how to hold it under their tongue. They have trouble following directions and staying still that long. On an unconscious patient, you could make them gag or choke. A patient who has had oral surgery or any kind of face or neck injury or mouth injury, we don't take an oral temperature on them. We don't take an oral temperature on someone who has a tube coming out of their mouth. So if they have an NG tube, a nasogastric tube that goes from the nose down the back of the throat, or if they have an ET tube, we do not, which is an endotracheal tube, we do not put a thermometer in their mouth. If they're confused, combative, or combative, we definitely don't want to put that oral thermometer in their mouth. Someone who's paralyzed, who's had a stroke and they're paralyzed on one side of their body, they may not be aware that it's in their mouth and they might chew. Someone who has seizures, they may inadvertently have a seizure and bite down and break it and cause damage. Someone who is short of breath, or who is a mouth breather, someone who can't breathe through their nose, or someone who is short of breath. We do not want to take an oral temperature on those people. A rectal temperature, we are going to lubricate that. We're going to cover that thermometer. We're going to lubricate it before we insert it into the rectum. We're going to ask them to lay on their side and on their left side and raise their right knee up and have their legs straightened out. We're going to insert it about an inch, and then we're going to hold it in place for a couple minutes. We do not ever leave a patient with any kind of thermometer in their body anywhere. We do not leave a patient while they have an oral thermometer in or a rectal thermometer in. And then we remove it, we take the cover off, and we read that rectal temp. You want to make sure that if someone has, if you're taking a rectal temp on someone, that they're not having diarrhea, they're not confused or agitated, they don't have some kind of rectal issue, they've had recent rectal surgery, rectal injury, or they have some kind of rectal issue. Also, we don't take a rectal temperature on anyone who has heart issues, because it can make their heart rate drop. It can make them pass out. So we do not have a vagal response. So we do not take a rectal temperature on anyone who has heart disease. Axillary temps, basically, we're still going to put a probe cover on it. We're going to have them raise their arm and make sure it's clean and dry. If they have been sweating, if they have if there's any kind of moisture under their arms, we're going to wipe that off, put the probe cover on, and then we're going to place the thermometer under the arm, and we're going to hold it in place. I generally hold it in place, and also help them hold that arm down. If you're using a glass thermometer, you have to hold that in place for 10 minutes. If it's a digital thermometer, it will read in about 5 minutes. So just know that axillary temps take a really long time, and we really don't like to use those if we can keep from it. Okay, let me see. Where are we on time? Let me see where we. Okay, guys, I'm so sorry. I had to step out for just a second. So we're going to stop with taking a temperature, and we will start tomorrow with taking a pulse. Be sure you have good notes, because you're also going to have a quiz over temperature and basic vital sign information and those normal ranges. You're going to have a quiz over that, so be sure you've taken really good notes, okay? All right, I will be back with you guys tomorrow, and we will cover pulse and respirations, and then we will cover pulse, and then we're going to cover the different types of pulse. We're going to cover respiration, and then we'll do blood pressure last. So if you guys have any questions, let me know, okay? All right, thanks, everybody.